Who's gonna love you like that? Taking care of yourself is a love no one else could ever give. Exercise and eating healthy, that's the best thing for your body. Smoking and drinking will not help. Sniffing and drugs, you'll hurt yourself. You gotta remember to check your blood pressure. You gotta take good care of yourself. Nothing.
Hello and welcome to another Health Matters program. In today's program, we're going to focus on this little thing on my chest here, which is a rosette. It represents the 16 days of activism against gender-based violence, which is an annual international campaign that kicked off on the 25th of November, the International Day for the Elimination of Violence Against Women, which will run until the 10th of December, Human Rights Day. It was started by activists at the inaugural Women's Global Leadership Institute in 1991 and continues to be coordinated each year by the Centre for Women's Global Leadership. It is used as an organising strategy by individuals and organisations around the world to call for the prevention and the elimination of violence against women and girls. The United Nations 16 Days of Activism Against Gender-Based Violence activities will be held from the 25th straight through to the 10th of December and will take place under the 2020 global theme, Orange the World, Fund, Respond, Prevent and Collect. In the course of November and December, if you are aware, we have been running activities through the Department of Gender Affairs. And today we are going to focus specifically from a male's perspective. Yes, you'll say why? Because we do know globally men do experience domestic violence. And today in the studio with me today, we have Mr. Macmillan Cuffy, who's a counsellor at the Mental Health Unit here on Nevis. So first I want to say thank you for joining us today for this special Health Matters programme. As you know, the 16 Days United Nations Convention for the programme around gender-based violence is running quite comfortably through the island of Nevis, and because the focus has always been around women and girls, we know from a male's perspective things do happen to men. Domestic violence is quite high globally, but it's just not discussed much. So I want to put it to you to talk to the general public about your perspective on what you think gender-based violence is.
All right, so thank you for having me. It's a pleasure, always a pleasure, especially about this topic that is, I think, very relevant, but unfortunately not much has been said about it. So let's start by first a definition. So according to the United Nations High Commissioner for Refugees, gender-based violence refers to harmful acts at an individual based on their gender. It is rooted in gender inequality, the abuse of power and harmful norms. Gender-based violence is also known as domestic violence, as we know it, or intimate partner violence, and occurs between people who are in or have been in a close relationship. When I say people, we know we have heterosexual couples, we have homosexual couples. Okay, so all relationships.
Right across the board.
Right. Domestic violence can take many forms, including emotional, sexual, and physical abuse, stalking, and threats of abuse and financial abuse. All of these are, in fact, types of gender-based violence. According to UN Women, as countries implemented lockdown measures to stop the spread of the coronavirus, violence against women intensified.
Yes.
And we cannot speak about gender-based violence without talking about COVID-19. Because we knew that because of COVID-19, there was a lot of lockdown, and so people were forced to spend a lot of time together.
Right.
But that doesn't mean that the relationships necessarily improved.
True.
For some, it may have, but for others, it meant that they were subjected to a lot of abuse. Okay, so reports of all forms of violence against women and girls, particularly domestic violence, began to rise. According to the UN, 86.9% of gender-based violence are females, an alarming figure. However, about 2 in 5 of all victims of domestic violence are men.
That's interesting.
Very interesting.
Yeah.
Women and girls however, may be at a higher risk of gender-based violence as we know it.
Okay, that's interesting, and the stats is something that we'll tap into a little bit later on.
But even before you go on, Sheila, if I may, we need to input violence as a definition here.
Yes.
So according to the World Health Organization, violence is the intentional use of physical force or power, threatened or actual, against oneself, another person, or against a group or community that either results in or has a high likelihood of resulting in injury, death, psychological harm, maldevelopment, or deprivation. Yeah? So I wanted to throw that in because we need to have a very thorough understanding of what we're talking about when we talk about gender-based violence.
Yeah. And you mentioned strength, and this is where the fairer sex fails, because we as women are not as strong as men. And I think that's probably why the percentages are a lot more higher.
I want to push back on that a little. Saying that women are not as strong as men, it depends on what you're talking about. What do you refer to as strength?
Okay, so women tend to be mentally stronger, but not physically stronger.
There you go.
And so that's the point I'm trying to make there.
All right.
Okay, all right. So we're coming into the gender itself. I'm going to ask you, are men victims of gender-based violence from your perspective?
That's a very great question, Sheila. And the absolute answer to that is yes. Domestic violence against men isn't always easy to identify, but it can be a serious threat, and it is a serious threat. Domestic violence from a male victim's perspective is something that is not discussed in society.
Right.
It's not discussed very much at all because information is very limited and incidents are often unreported. Okay? So I must say that the stats out there, whether it's male victims or female victims, the stats are skewed. But even more so, for males, that it is really underreported.
Do you think the reason why it's underreported, Max, is it because men are too embarrassed to report it because they're the male and they're meant to be strong and they're meant to be like in control? What do you think that's about?
Yeah, all of what you said, because men are traditionally thought to be physically stronger, as you indicated earlier, than women, they are less likely to report domestic violence due to embarrassment. Okay? But contrary to popular belief, Sheila, there are a growing number of men who are at the receiving end of harassment and face psychological, emotional, and physical abuse by women.
Yeah. That's quite worrying, isn't it? What are some of the examples you can give of gender-based violence? What different forms can you offer?
Sheila, even before we go on there, let us make it absolutely clear out there that gender-based violence there's a zero tolerance for that. No matter who the perpetrator is, no matter who the victim is, we do not in any way advocate, condone domestic violence. So even though today we are looking at the men's perspective on gender-based violence as a victim, we do not in any way encourage or condone men, beating up on women or doing any kind of or gender-based violence against women.
Absolutely.
Neither are we condoning or encouraging women to be perpetrators of gender-based violence towards men. I just want to put it out there. All right, but your question was...
So basically just some examples of what it looks like. What does gender-based violence look like?
So, if your partner calls you names, insults you, or puts you down, that is an example of gender-based violence. Prevents you from going to work or school because he wants to be the breadwinner so he can control you because he is the breadwinner. That is a form of gender-based violence. Stops you from seeing family members or friends. Tries to control how you spend your own money, where you go, and what you wear. Acts jealous or possessive or constantly accuses you of being unfaithful, even when there is no evidence of that or reason to believe so. Gets angry when drinking alcohol or uses drugs. Tries to control whether you can see a healthcare provider. Threatens you with violence or a weapon. Hits, kicks, shoves, slaps, chokes, or otherwise hurts you, your children, or your pets. Because some people's pets are very dear to them.
Of course,
and if he thinks that he can harm your child or your pet to get back to you, that is a form of gender-based violence.
Yes.
Forces you to have sex or engage in sexual acts against your will. That is a form of gender-based violence. blames you for his or her violent behavior or tells you that you deserve it, threatens to tell friends, families, colleagues, or community members your sexual orientation or gender identity, that all of these are examples of gender-based violence.
And the list is quite long, and most people listening to that probably don't know half of what's just been said on that list, because the norm is physical. People don't even recognise emotional abuse. They're in it and they don't even recognise it. So you've definitely got a very comprehensive list there, and I hope people who are out there listening take on board what Mr. Cuffy has just said, because it's not just about the physical.
Absolutely.
It's a whole barrage of abuse.
Absolutely.
That cannot be tolerated or condoned.
Zero tolerance, as we say.
Okay, so the next question I have for you is, where can one find help if he or she is a victim of gender-based violence?
So, I always say, Sheila, whether it's gender-based violence or any problem that anybody is encountering, you find someone that you trust. And I want to emphasize that, someone that you trust. We have a tendency, well, not we, I don't do it. People have a tendency to just peel out their personal business to any and anybody. I'm saying that person, make sure that person is someone you trust with your private business, and that will respect your confidentiality and your privacy. Yes? And so turn to a friend, a relative, a neighbor, a co-worker, or religious or spiritual advisor, a counselor, a mental health provider for support. All right? The counseling or mental health center, in your community, as we know, counseling and support groups for people in abusive relationships are available. Can we do more? Yes, we can. Yes. But definitely there are people that you can turn to. We have the Gender Affairs Department, we have the Mental Health Unit, we have social services. All of these agencies provide counseling, all right? Your local court, because it may very well come to the point where the abuse is so bad that we may have to have a restraint order in place. And so the court can help you to obtain a restraining order that legally mandates the abuser to stay away from you or face arrest. Local advocates may be available to help guide you through that process. And again, that's where the agencies come in. We can help guide these people as to, how to obtain that restraining order. However, sadly, unfortunately, some people, they get the restraining order, but they help to break the same restraining order against them.
Yes.
Okay?
Yeah.
So, it calls for some empowerment of the victims, whether male or female. But we got a lot to do, Sheila. There's a lot of work to be done.
I totally agree with you there. I mean, in terms of support groups, do you know of any local support groups on the island?
Right now, as we speak, no. As I mentioned, the agencies, the social services, mental health, gender, these are the government offices I know that are charged with this responsibility of helping victims. But even the perpetrators too, because when we counsel, we don't own it. The perpetrators need to understand that something is not right with those kind of behaviors. Absolutely. And they need help too. Sometimes we focus a lot on the victims, but sometimes we tend to have that negative thing against the perpetrator and those emotions, but they too need help.
Of course they do.
Yeah, so these departments can help and assist in that regard.
Wonderful, wonderful. And I think lastly, because, we look at people every day and we don't know who is and who isn't abusing persons. So what would you be looking for in a person? What is a profile of an abuser?
Very good question again. An abuser would apologize or promise to change or offer gifts after abusing his or her partner.
Yeah.
Yes?
Yes.
And they make excuses for their behavior. They blame the victims or their partner for their being abusive towards them. The abuser obviously strikes or will exhibit abusive behaviors and threatens violence.
Yeah.
Sometimes they may not actually act out, sometimes, but they would constantly threaten. These are red flags that need to be paid attention to, and especially where they apologize but continue to do it, where they beat you up or they commit these acts of violence and then promises not to but continues to. And the gifts, expensive gifts, as a way of making things right, but then continues to do it. I mean, what are you saying? You understand? So it's like a vicious cycle that just continues to repeat itself. And we need to be guarded against these profiles, what I just listed.
Absolutely. Thank you so much. I mean, that's an awful lot we've covered, and there's a lot more to be covered.
But even before, though, can we do some local stats?
Sure, we can do the stats.
It's interesting. So I look at some of these agencies I mentioned, and, the local stats here on Nevis are not too far from the global statistics, unfortunately. And we have a small we have a small population here, and then when we looked at it, we have an 87.5% of females here on Nevis.
Yeah.
And these are just the reported cases.
Exactly.
Remember, that is skewed, right? 87.5% that have reported gender-based violence. There's a 12.5% of males who have reported. Again, that is grossly skewed.
Yes.
Because you know about men and our egos and our embarrassment and our shame. We're supposed to be the macho guy, the masculine guy, the tough guy. And to go to the police and report that, and the police have to be jeering at us and laughing at us. We don't want that, so we keep it to ourselves, yeah? And post-COVID-19, there are some stats. There's a 62.5, I repeat, a 62.5% increase on Nevis.
That's very high.
In gender-based violence.
And
that is just the reported cases. I can bet my last dollar that it is higher than that.
Of course it will be.
Yeah? But I want people to be mindful that these stats are grossly skewed, as I said, since many cases are not reported. Yeah? So we're calling on people who are victims, whether male or female, especially, well, both. Not especially any.
Yeah.
Because gender-based violence is gender-based violence.
Absolutely.
But we're asking persons to come forward and report the cases, because there are agencies out there who are able and willing to assist and to, stamp out that, that just is a sort of negative phenomenon in our society.
Yes.
All right, so I just wanted to leave that with you, and I hope that we were able to reach out to the audience out there, educate them, and hope that persons are more aware of gender-based violence and come forward and report these cases so that we, all of us together, can stamp this out. Thank you.
Thank you so much. So you've heard it from Mr. Macmillan Cuffy from the mental health unit. He's a counsellor there. He's reaching out to everyone who's watching this programme. Don't be afraid to come forward and talk to somebody that you trust. The police are available, gender affairs are available, mental health is available, social services are available. There are several persons out there that can assist. But you, the general public, need to be very aware that it is actually happening around you. It could be a neighbour, it could be a friend who you're not even aware these things are happening to, but you're seeing the signs. Open up, speak to somebody, and let's try and reduce and eliminate gender-based violence here in the Federation of St. Kitts and Nevis. I'm Shelagh James. Thank you for watching. Until the next time, goodbye.
Who's gonna love you like that? Taking care of yourself is a love no one else could ever give. Exercise and eating healthy, that's the best thing for your body. Smoking and drinking will not help. Sniffing and drugs, you'll hurt yourself. You gotta remember to check your blood pressure. You gotta take good care of yourself. Nothing